Hello everyone, I am Dr. Mahadev, Medical Head, Medicover Hospitals Vizag. Today we are with Sibasankar Dalai sir, our Senior Consultant Neuro Vascular Intervention. Hello sir.
Hi.
Hi sir. Today I wanted to know about brain aneurysms. Can you please explain about it?
Generally, the blood vessels in the brain, they have three different layers. So, as the blood supplies into the brain, they get into the stress and strains. At some portions of the brain vasculature, the blood vessel becomes thin and they balloon out. So, the ballooning out of the blood vessel inside the brain is called an aneurysm, which is a weak area inside the brain. Because it's a weak area inside the blood vessels in the brain, which is called an aneurysm, they can rupture, bleed, and can give rise to a particular kind of brain hemorrhage, which is called a subarachnoid hemorrhage.
And can we know about any presentations or symptoms regarding aneurysm? Yes.
So, whenever there is a brain aneurysm, which I told is a weak area over the blood vessel, it bleeds, then the patient typically complains of sudden severe headache. A patient which was very comfortable otherwise will say that I am having the worst headache of my life. Please note this point, worst headache of my life. So whenever there is an aneurysmal rupture, the patient presents with the worst headache of their life, and that's a thunderclap headache. That is the first most common and significant symptom. The second one could be neck rigidity. The third one, if the bleed is so severe, then the patient can actually die or can have a neurological deficit like blindness or sudden loss of consciousness. So if I have to just tell you number wise, the first and most common symptom for a aneurysm bleeding is sudden severe headache. That is the worst headache of his life. The second one is there could be neck rigidity, pain in the neck. The third one, patient can go unconscious. Or the fourth one, there could be a visual loss. So this could be symptoms of a brain aneurysm which has bled. Now, sometime there is a brain aneurysm which has not bled, but if it is big enough, then also we can have pressure symptoms inside the brain, like if the aneurysm is sitting over the nerve or the artery which is just very close to the nerves, then the patient can have drooping of eyelid, or patient can have different type of neurological deficits.
Sir, what are the different types of treatments for this aneurysm?
First of all, whenever we see a patient of aneurysm, there are three different types of complication for a patient who has a bled aneurysm. Number one, when there is an aneurysm bleeds, let's say 100 aneurysm bleed today across the country, then 30 of them, they cannot reach a hospital. They will die before reaching a hospital. It's such a dangerous disease. Out of the 70 patient who comes to a hospital with a bled aneurysm, there is a possibility that the aneurysm will bleed again within 21 days. Half of them, they will bleed. And once a brain aneurysm bleeds twice, then 99% of the patient, they die. So it's an emergency and we have to treat it very, very fast. The number two type of complication we deal with when there is a ruptured aneurysm is a vasospasm. Because there is a bleeding in the brain and the blood is all around the blood vessel, it can actually constrict the blood vessel and patient can land up in the stroke. Third, because this type of patients are admitted to ICU for some time, there is a possibility of ICU related complications. So these are the three different type of problem: aneurysm rebleeding again, vasospasm because of the bleed that has already happened, and ICU related complication because of prolonged stay in the hospital. Now if you look at the treatment, we have to focus our treatment in all three areas: to treat the aneurysm so that it doesn't bleed again, or to take care of the vasospasm so that doesn't lead to stroke or other complications, and of course the best ICU care. So these are the three different types of treatment we should do. And the most important of all is to treat an aneurysm. Treating an aneurysm in the brain, there are two different types of treatment. One is to open the skull, find the aneurysm, put a clip, that is called clipping of aneurysm. And the second one, which is a most modern treatment, without opening the skull, we can go from the leg blood vessel or the hand blood vessel, we can reach the aneurysm and we can do coiling. So brain aneurysm coiling is the most modern and the safest method to treat brain aneurysm.
Sir, how we can prevent this? Any preventions are there?
Most commonly, we see aneurysms are seen in 4th or 5th decade in women. And if you really want to prevent aneurysm, we do not have a concrete answer why an aneurysm comes. But there are some suggestions where we can prevent aneurysm. The first thing is that patient who smokes a lot are having prone for aneurysm. Second, cocaine abuse. Third, stress. Fourth, uncontrolled blood pressure, high blood pressure. And the other one is a sedentary lifestyle. So these all can actually cause aneurysms. So if you have your blood pressure, get it checked and get into control. If you're a smoker, immediately it's a time to just stop your smoking if you want to prevent an aneurysm in the brain. If you're a cocaine abuser, immediately that should be stopped. And the other thing is that in your family, if your father, mother or any of your family member had an aneurysm, you better get checked up with an MR and MR angiogram of the brain, which will tell us whether you have an aneurysm or not. And the last but not the least, if you're having sudden severe headache or frequent headaches, then you should better get it checked. You might have an aneurysm. So these are the ways to prevent aneurysm.
Sir, thank you so much, sir, for sharing your valuable information with us, and it would help us to know about aneurysm. Thank you, sir.
Thank you very much.